Hello there, and a very warm welcome again to one of our intriguing interviews with some of our leading consultants in the UK. And today I'm delighted to say we're joined by distinguished and highly revered consultant plastic surgeon, Mr. Jonathan Britto. And he is joined by two members of his team as part of the aesthetic surgery team. And we're here to talk about all things aesthetic surgery. And well, Mr. Britto, if you'd like to maybe provide some background information maybe before we get into the questions about your experience.
Well, that's very kind of you. Thank you for having us to the Top Docs podcast series. My name is Jonathan Britto. I'm a consultant plastic surgeon, nearly 20 years. Began my life in craniofacial reconstruction for adults and children, young children born with facial differences that as part of a team, I helped to provide both appearance benefit and functional benefit for those children in breathing, in vision and feeding and so on in the world. My team is Karen Sargeant, who's there on the screen. Give a wave, Karen. Who is an aesthetician, an expert in skin health, and Dr Shyamala Moganasundram, who is a lifestyle medicine physician. And we hope to give you some idea about why I've pulled this team together for private practice aesthetic surgery.
Fantastic, Mr. Britto. A very interesting overview, and delighted to be joined by your two members of the team. And thank you so much, both of you, for joining us. And Mr. Britto, it's going to be very insightful. Thank you.
Thank you.
Okay, guys. So the first question then I have for all of you and Mr. Britto is, in what ways can aesthetic surgery be performed?
So that's quite an intriguing question, because one can take that as a very technical thing. You know, how do you do a particular procedure? But for us, the technical aspects are a given. I have to be technically as good as I can be in the surgery I do. But the wider issue is, how can it be performed safely, effectively, to give a patient a happy result, and why do we do this in a team? So the technical things, how do I do a particular operation, I've learned over many years, more than I can count. And from an anesthetic perspective, we work within a team that requires good quality anesthesia, and I tend to do most of my procedures under a twilight anesthetic. And what that means is a conscious sedation where patients are awake, they're aware, but they're totally comfortable. So that's a rather unique thing for my practice, predominantly in the face, where my patients are aware. They can speak to me as I'm operating. They can open and close their eyes, for example, so I can get that accuracy really spot on. And then when the procedure is finished, they are immediately comfortable, fully conscious, with no post-anesthetic downtime, which means reduced bruising, reduced swelling, and a better experience for patients. So that's one sort of way in which surgery can be performed. And then, of course, the things that we do with the layers, for example, in the face, depend upon quality skin health, which is where Karen comes in terms of preconditioning and looking after our patients, and how we can prepare them best in terms of their fitness for the procedure, which is where the lifestyle medicine approach comes in Shyamala's hands. So maybe I can ask Shyamala to just take that on and explain what that means.
Absolutely.
Hi.
Hello.
One of the things with surgery and anesthesia is there is this whole inflammatory process that goes on with it, and a lot of it is good and functional, but there are also downsides to it. And without what we do with the lifestyle medicine is we prepare the patients in the 2 weeks leading up to surgery so that we can diminish the negative effects of the inflammation, like swelling and that sort of thing, and just allow them to have the benefits. And we've got good evidence in surgery in general over the last few years that this kind of preparation does give you better results at the end of the day. So we're very happy that we're able to provide it for our patients.
It's the prepare and repair. And we brand it up so that patients can really be aware of the changes they can make to reduce that inflammation, to improve their outcome. And in thinking about the skin aspects of things now, I might just ask Karen to mention that.
Hi. As Shyamala says, we're looking at reducing inflammation, and with any surgery, whether it be on the face or the body, there's a level of trauma exerted on it. So it's important for us to prepare the skin for that trauma that it's going to experience and manage it in the best way. So preparing it for the inflammation so that it has quicker healing, recovery rates. But importantly, a big aspect of this for patients with any surgery is scarring. So we want to make sure that that scarring process is managed as best we can, and starting by preparing the skin beforehand and then working on it afterwards will really help with that scarring process with recovery, and also to enhance the surgical results, because Jonathan will probably talk later about the skin being the envelope, and it's what we see, and that the age of the skin will not change with surgery, but we can make it look younger by using certain topicals on the skin to enhance the surgical results.
Absolutely. It's a fascinating insight and very reassuring that patients can have a wide variety of skin care and aesthetic surgery. And are you guys seeing that that aesthetic surgery is becoming more and more popular in recent years?
It's interesting that, because of the approach that our team takes. So I am no longer at the tender age I once was. Older than I once was and younger than I'll be is the way that I'll but I want to keep the confidence of looking and performing well. So I'm middle age, I want to look good, feel confidence in appearance, but I also want to perform better. I want to be able to get to the top of the stairs without taking the lift. I want to be able to eat better, play sports, enjoy being on the dance floor, all of those things. And I think because society and the world demands so much from us now for longer in our lives, and we're working for longer, we need to be competitive in the workplace. So all of these different pressures bring people to the door to optimize what they have and protect and maintain it going forward. And that can be in terms of confidence in appearance, confidence in performance, the ability to look after their own skin when they look in the mirror in the morning. And all of these things are very firmly part of the medicine of well-being.
Fantastic, Mr. Britto. A very, very interesting overview. Once again, thank you very much for all of your input for that first question. That was very interesting, absolutely. And leading then nicely to our second question, why is that aesthetic surgery best delivered with a multidisciplinary team?
I'm going to let Karen start with that one.
Of course. Okay. I think patients, we feel so because we want to give patients the best that we can. And, whilst people can go off and have surgery and, in the UK and abroad and everything else, there's so much more that they can get from it and benefit from that surgical experience, and not just the visible signs of surgery. So, just feeling better about themselves, being looked after, being supported, all of those things are really important to our patients and what we want to give them. And so, having the team, and not just us as the practitioners, but also, from our medical staff in the office and that kind of thing, we want that patient to feel fully supported with everybody that they come into contact with when they're having surgery with Jonathan. And I think that makes the patients feel special. We're looking after them, and we can get so much more from their surgery. And Jonathan will probably give you some examples of when patients come back to us, and some of it is life-changing. They feel so much more confident, not just from the surgery, but the input that they've had from the whole team. And that's really important to us.
Absolutely. It's fantastic. Must be for the patient journey. It's very beneficial for them to feel supported right the way through their process. Absolutely.
Yeah.
Charlotte, did you want to?
So in what we do from a lifestyle medicine perspective, in addition to the physical bit of dampening the inflammation and reducing water retention and things. We also look at things like their sleep beforehand, their stress levels beforehand, so that it doesn't just, as Karen said, make the whole process better for them. They will also benefit post-surgery from having had adequate rest, having felt calm, having a positive outlook on what they have experienced before the surgery, what they're going to experience. And all of that is part of our prepare and repair process as well. So taking not just the body, but the mind and the mental status to give them the best surgical experience as well as outcome.
If I could add to that as well, we're talking a lot about the preparation, but a big question we're always asked in consultation is how long will my surgery last? Well, that's very much down to them post-surgery and how they look after themselves. So we're not just about, how can we prepare you for this surgery and make it better for you, but how can we actually look after the surgical outcomes post-surgery and get the best out of it for you. And that's both parts are equally as important. And we can do that for them. We can make the surgical outcomes last for longer.
Absolutely, that is fantastic. Like a very holistic approach in general to the patient, which is really fantastic to hear. Absolutely. Well, and question 3 then for all of you. What is the most popular surgical procedure that you're seeing now that falls under the aesthetic surgery category?
So that's a very interesting thing. I think that in terms of what can be done technically, so what is the most common procedure in the UK, for example? That would still be a breast augmentation, a breast enhancement. I think probably still is at the top. But all of us develop very particular interests and expertises. So for my practice, for example, I think probably the most common procedure would be in the face. Eyelid lifts, blepharoplasties, face lifts, rhinoplasties. These are all ways of changing the appearance of the face. And they're done, really, it's about confidence in the older group of patients who see facial change. But in the younger group of patients, also about confidence. It's about maybe having some unloved feature that has always been a niggling point of lack of confidence, whether it be coming out of school, going to university and wanting to change the shape of your nose, whether it's functional rhinoplasty, not being able to breathe quite as well as one might have wanted, or even a small thing like having a mole on the chin or on the cheek, which changes life every bit as much as a procedure that takes 5 times as long and is 10 times as complex. So the unifying thing really with aesthetic surgery is designing a surgery that has maximum impact, even though itself might be a small procedure. It's not just about physical change. It's about the impacts going forward. And I always say to my patients and to our trainees who come through the practice that we operate on features, but we're measured in feelings. It's the psychology, the happiness of the outcome that's as important as the procedure itself. And that is the unifying thing, I think, with all aesthetic surgery procedures, whatever their top level or bottom level of frequency or popularity.
Absolutely. Very interesting to hear that, Mr. Britto, that people want to fix maybe things that they weren't happy with or just to feel more confident. That must be a big factor that you see, confidence.
It is, and it's not always about aging. It's not always about being more youthful. It can be, if, for example, the classic thing is the Chinese double eyelid, where the Oriental eyelid doesn't have a double fold, it doesn't have an eyelid shelf. And so the eyelid shelf can be made surgically by reconstituting or changing the anatomy of the eyelid. So that's got nothing to do with aging, but a lot to do with confidence. Or, for example, I've seen some of the work Karen does with our patients with really debilitating acne. Now, that's not surgical at all, but it makes a huge change for confidence in young people, whether they're stepping out into the workplace or moving from school to university. These are the unifying reasons for why aesthetic surgery procedures, or even non-surgical procedures, are so popular and so effective as well.
Absolutely. Fantastic. And our next question is quite similar then, leading us nicely. In what ways might aesthetic surgery go wrong? Are there potential complications for patients that they should be aware of?
Well, so any surgical procedure carries a risk. As soon as an incision is made, there will be a risk. And in that case, the risk might be making a poor scar. And then as the complexity of the surgical procedure increases, each layer of tissue that we operate on has a potential benefit and a potential downside. But when patients ask about what might go wrong, I tend to reiterate this thing about we operate on features, but we're measured in feelings. So we want to make sure that the surgical procedure is well introduced, well managed, so that patients understand what their outcomes are going to be. And more importantly, so we understand what it is that the patient is seeking. So if it's about confidence in appearance, is it about resuscitating a relationship or getting a job? Because no surgical procedure will do that for somebody. It will increase their confidence, but it won't necessarily deliver the outcome of a new career. So that might be considered by a patient as going wrong, but it isn't in fact going wrong. It's about not really doing the right thing for the right reason. Things that more classically might be considered as going wrong are infections or appearance not being the way that it was intended to be. So an infection is a physical adverse event, and we manage that to resolve it and then get people back to health. Not achieving the desired result is expectation management. And I say to my patients, you're here, you want to be here, we'll get you as close as we possibly can, maybe even beyond. But sometimes we might fall short of your expectation. And that expectation may change from the first meeting to the actual procedure or to the end of the recovery time. And that is why being in a team, having a team in the room that understands all of that can be very supportive to patients. And the bottom line is our audit figures show that very, very rarely do we not get to a point of happiness with a patient. And if on occasion we might not, we've always got a very good support network of colleagues, people we can ask for a second opinion and so on. So our patients are very well looked after.
Fantastic. And that must be the main aim for you guys and on the multidisciplinary team. The patient satisfaction is a huge motivational factor for you, treating the patients. So that's fantastic.
Well, it's great, and we can measure that satisfaction. We measure it in three ways. So we have a very robust system of patients sending us testimonials and reviews, which we're very grateful for. So if you've been one of our patients, thank you so much for saying nice things about us. Thank you also for feeding back when things don't go the way you want them to, because some of those things can be very, very easily resolved. We have our patient ambassador system, where we ask patients whether they would be willing to be a mentor for an upcoming patient who can then smooth the way in lay terms and help to translate any insecurities or anything that was misunderstood, and also can provide real empathy from having been through something similar themselves. So that's the ambassador system. And then in the follow-up period after the surgery or the procedure, we will ask patients for their patient-reported outcome measures, which are a very set of questions asked to the patient before the procedure and at 6 or 12 months after the procedure, where they feed back in a very rigorous way in terms of the publications behind these questionnaires, And we can then get a real feel for whether we're doing good things for patients. And thankfully, those reporting systems have been very robust and very valuable, so that we continue to know that we're helping people through, rather than just having patients say to us, "Thank you so much for changing my life," which is always lovely to hear. But with these systems, a little bit more robust than that. They help us to really measure the quality of our outcomes.
Absolutely. A fantastic process, really, for you and the patient to just know what it is, if their expectations were met, and can you improve for future scenarios. So it's really a win-win. So that's fantastic to hear. And well, our next question then for you guys. In general, how satisfied are patients with the results following aesthetic surgery? You touched on it there, Mr. Britto, that the majority of patients are very happy.
Well, I think that some of them will say things to Karen they won't say to me in clinic, so maybe she should answer.
I think, as Jonathan's just explaining there, the processes that we have, and it's all down to communication, and it's a two-way communication. You know, we've got to keep communicating to our patients, and we very much want them to communicate back to us. And the way of doing that over time is by establishing the relationship with the patient where they do feel comfortable to say, you know, I was really happy with this, but we always get the but, and it's normally a very small thing, very easily that we can, you know, do. But yeah, that's really important to have that communication, because we want them to be able to speak to us and raise any issues or concerns that they have. And we have patients say, gosh, if you know, Jonathan's reviews, they'll say there what a great pathways there are for communication, and how any small question, however silly it may have sounded, they had that, they felt comfortable enough to ask. And I think having the team, you know, if they're not going to speak to Jonathan about it, they'll speak to me or one of the girls in the offices or whatever. We also have the psychology, Jonathan touched on that earlier. So every aspect of their well-being is supported, and that is through communication.
Absolutely. Fantastic to hear as well. Patient satisfaction is just, well, it seems as though it's a real priority for you guys, which is just so good to hear. Absolutely.
And we see it in the lifestyle medicine too. Some of the patients who have been through programs will, and they retain and maintain them. So they're mentored programs. I don't know if you want to say something about that.
So it's all a lot of what we tell patients to do from a lifestyle medicine perspective. After you've heard it, you might think, yes, that makes sense. And yes, that evidence is convincing, but they're not always easy to maintain by yourself. And the other thing about it is that it has to be consistent. So, you know, for example, it's not much point sleeping properly today and then tomorrow you have, you know, very little sleep, or it's, you know, you run miles one weekend and then you're sedentary at your desk for, you know, the following 2 weeks. And our mentoring programs basically help people to make these changes. And what we do is we hold their hand and take them through it slowly, making one change at a time, adapting it according to their lifestyle, their ability, what they can do. And slowly we get them to feel the effects of the changes. And that, of course, is the strongest motivation. Once they actually feel the effect of the changes, then it's so much more motivating for them to do it. And then we can slowly let go. You know, they can slowly do it on their own. And the idea is at the end that these people go off and they have a much healthier, happier, and hopefully longer life. But, you know, good quality, high productivity type life.
Absolutely fantastic. Very well said. So reassuring for all patients watching. So really fantastic. And well, our last question, actually, guys, already, it's been a fast discussion, but very insightful. So our last question then, what are the main reasons that patients opt for aesthetic surgery? I know, Mr. Britto, you touched on the confidence factor, but are there any more main reasons why people opt for surgery?
So, yeah, it's interesting that I will sometimes get patients who come and they'll listen to the consultation, they'll engage with it, they'll ask their questions, and they're usually quite well prepared. And they'll say, can I get into the diary? Can you do this for me in 3 weeks' time, and I'll be very specific. And immediately I'll be wondering, well, what's that for? And there'll be a wedding, or there'll be a family party, or there'll be an interview, or there'll be something to be ready for. And so quite commonly, there'll be an event which is a catalyst for the desire for physical change, for appearance change. That it can be quite challenging, because we want to make sure that patients get through their surgery fully recovered, both physically, so that everything's well balanced, looks natural, with hidden scars, so that they can pass muster quite happily down the video screen or across the table, and feel confident. And that requires a certain amount of healing time, and also psychological adjustment time, to get used to the new nose, or the new balance to the face, the new jawline, and so on. And so that's very important in terms of what motivates people, and thinking from a holistic perspective about what's motivating people for aesthetic surgery. And I might say, well, look, get your interview done, get through the wedding, come see me afterwards, totally relaxed, under no pressure, and then we'll see you through this, because this is not just physical change, it's about well-being, and it's about longevity. But I think the social pressures that we see down the video screen, in the social media, are part of the motivation. Maybe not quite as much of the motivation as we think, but they're quite a lot of the motivation. And I think that's also a bit generational. So in the younger patients, in my practice, maybe breast augmentation or rhinoplasty patients, they will be more heavily influenced by social media, whereas the more peer-to-peer, the patients of mine who are more of my own generation, who are coming for facelifts, or for eyelid lifts, or tummy tucks, or whatever procedure, more generationally based, they're not so influenced by the social media. They're more influenced by their own personal confidence. In many ways, their children have come, left home, moved on, they've got a bit of money in the bank, they're in a point in their careers where they're a bit more stable, and their motivation is different again. But I think our main aim is that we're not just about a procedure, we're about a full care. As much as patients wish to engage, we will provide that full care, so that it's about looking more confidently, feeling more confidently, and maintaining it with a better performance and performing better as those physical changes give that increased confidence.
Absolutely. Well, Mr. Britto, thank you so much for that amazing answer at the end there. Very insightful. And well, the multidisciplinary team in aesthetic surgery, it's been a very insightful interview. And if anybody would like to find out more information about Mr. Jonathan Britto, or the procedures that he specializes in, and his multidisciplinary team, which you've heard a really good insight from today, you can visit the Top Doctors profile of Mr. Britto at www.topdoctors.co.uk. And for now, thank you very much to all three of you guys. Thank you for your time today.
Very much.
Thank you.